Thank you, everyone. It was great to be a part of the last bit of your breakout groups and hearing some of the suggestions and thoughts that came out of that. And I think you'll see actually some of that come out in some of what I present today, which are the results of the OurCare National Research Survey. So I think Richard told you a bit about me. I'm a BC-based family doctor. I work here in the Lower Mainland doing outpatient family medicine, and then I also work as a hospitalist at Surrey Memorial. In addition to that, I'm our regional physician lead for OurCare here in BC, and I do some systems work trying to, trying to figure out how we can shift our system to better serve patients, whether that's through funding models or thinking about ways of adapting the system, like shifting towards more robust team-based care. I'm thrilled to see everyone here today, and I appreciate you taking the time on, what I'd argue is the nicest day of the year so far. So I know there will be a few hours left. I'm coming to you from the Squamish, Tsleil-Waututh, and Musqueam Nation. And let's get into it, because I know we might run a little bit short on time. So this, the OurCare National, the OurCare Survey, is part of the OurCare project, which, you know that you're part of phase 2, so the priorities panels, and this national survey came first, and it was done in the fall of 2022, and it surveyed people across Canada in every region. It was conducted in English and French. It took about 15 minutes. Many of you will have done it, and so you'll know it took about 15 minutes to complete, and it was only available online. We recruited patients in a couple of different ways, through word of mouth, whether that was through social media, through our community networks, or through so we have a partner, Vox Pop Labs, who has a panel of citizens very similar to you across the country, who answer, surveys like this, and so they filled it out as well. We had over 14,000 people from across the country respond into this survey, and you'll see what we're presenting here is the results from 9,000 or so people who completed it, and I'll explain why. What we asked about was primary care. Do you have a family doctor? What does that look like for you? Can you access care? We asked about virtual care, walk-in care, teams and team-based care, and whether that was available to patients. We asked about some of the issues you were discussing around access to medical information and your charts. And then we also asked about reimagining, like, what could the future look like? But you can imagine a survey is only going to be able to go so far to be able to answer those kinds of questions. And then at the very end, we asked demographic data. So age, gender, education, income, language, region of the country. And that was really important because, our survey, what we're presenting today is the result of the weighted responses, because our goal here is to try and understand, what does the average Canadian, how does the average Canadian think about these issues? And you can imagine, even though we surveyed 14,000 people, their demographics, so, age, income, gender, the people we surveyed isn't necessarily going to match up exactly to what Canada looks like. And so what we've done is use statistical methods to try and so, for example, if more men in our survey would have filled it out versus fewer women, then, and compared to how many men versus women there are in Canada, any man's response might be weighted a little bit less in the final analysis than a woman, so that our overall results capture what Canadians more broadly feel. Surveys have limitations. You can imagine that or we know from our demographic data that people new to Canada, people who are racialized and Indigenous, people who might have language barriers where they have difficulty engaging with an English or French language survey, they were underrepresented by our survey. And generally speaking, a survey doesn't allow for a back and forth dialogue and a deep understanding of some of these issues. And that's why you're here and you're working through this today. What I will mention as well is, so this is very much the work of the entire project team. So Dr. Kieran, I know one of our team members, Miriam Dinesh, really pulled together a lot of the data and the graphical representations. And so all of what I'm presenting here is what the entire project team has done. You can explore the data yourself at data.ourcare.ca. And if you have any trouble doing that, I know, during our in-person sessions, we can certainly help you work through that. Okay. So let's get into it. So the first part of our survey, we asked about people's experiences with primary care. And so by and large, the biggest finding out of the survey was that 22% of people in Canada over the age of 18 did not have a family doctor or a nurse practitioner. So a regular health provider who they were able to see regularly for their care. If you were to translate this to the full population of Canada, like that would mean 6.5 million adults don't have a regular care provider. And if you compare this back to previous data, like surveys done around pre-pandemic, around 2019, numbers we thought at that point were closer to 4.5 million. And so we think what we call the unattachment crisis has gotten quite a bit worse. More people, if you compare across the country, Ontario, more people had a family doctor in Ontario than anywhere else in the country. In BC, 27% of people didn't have a family doctor. And if you extrapolated this out to our population in BC, that would be something like 1.4, 1.5 million. Which is more than what the current estimates are that I think have been in the media that you may have heard of around 1 million unattached. Comparing the people across some of our demographics and who has a family doctor and who doesn't, people with high incomes were more likely to have a family doctor. Women were more likely than men to report having a family doctor. And older people, so people over the age of 65, were more likely to have a family doctor. And just looking at this last line here, if 86% of people over the age of 65 are saying, I've got a family doctor, that means 14% don't. And I think most of us would argue, well, everybody needs a family doctor, but particularly as you get older, even if it's just for preventative health. And among our younger age group, almost 40% of 18 to 29-year-olds didn't have a family doctor. So I think that's important food for thought. If they had a regular health provider, who was that regular health provider? Typically, so 95% of the time, it was a family physician. 5% of the time, it was a nurse practitioner. So then we asked the people, okay, so if you have a regular health provider, can you actually get in to see that provider? So we asked about timely access. And so we asked them, if you have an urgent issue that you need care for, are you able to see someone either before 9 to 5, after 9 to 5, or on the evenings and weekends? 37% said no. There's nobody in the office, whether it's my doctor or somebody they work with, available to see me around the 9 to 5 or on the weekends. 27% didn't know. And so maybe that's because they didn't necessarily need that care. But I thought that was interesting and has implications for use of other services, including, I think, emergency department use, and whether that's maybe used appropriately or not for things that are actually emergencies. Then we asked people if if they'd had an urgent need in the last 12 months, how long did it actually take you to book an appointment with your regular health provider, whether that's a doctor or a nurse practitioner? And 35% of people were able to get either a same day or next day appointment if they had a regular health provider. About 50% said they could get in to see somebody within about 3 days. But 21% of people, so 1 in 5, who tried to get an urgent appointment had to wait 2 or more weeks or were never able to get an appointment. Okay. So then the next part of our survey went on to talk or ask questions of people who didn't have a family doctor. And so we asked, like, if you don't have a regular doctor or nurse practitioner, is there, like, do you have someone you actually go to for some kind of regular healthcare? And 12% said, yes, I do. So then we asked, well, if you do, then who do you go see? And I know there's a lot going on in this graph, but 25% of the time they went to see a specialist doctor. And to provide some context there are actually scenarios where if somebody's end of life, and they have a palliative care doctor, for example, or if they have, for example, end stage kidney disease and they need dialysis and see a kidney doctor really regularly. Sometimes a specialist doctor actually, it is appropriate for them to see you very frequently and provide most of what we would consider primary care. But in other scenarios, like if it's a surgeon, for example, most of primary care wouldn't be in a surgeon's scope of practice. Our respondents also said, I consider my pharmacist a source of regular healthcare, a nurse, and then there were other answers as well. So among people who didn't have a family doctor, we asked, well, if you needed care, where did you go? And the number one place people went was an in-person walk-in clinic. Next was a virtual walk-in clinic. But after that, the hospital emergency room was, 24% of the time they went to a hospital emergency room. And I think these results are important in the context of, what I think about is in-person walk-in clinics are closing. In a lot of our communities, we're seeing fewer and fewer of them. And if they are a place where people who are unattached, and we have 1 to 1.5 million people unattached, if that's where they go to get care, then what are those patients' alternatives now? And then what I think, might be some food for thought for your discussions about virtual care is, well, if someone doesn't have a family doctor, they're only able to access virtual care. Well, what if, does that virtual care always come with an option of also having in-person care? So then we asked, if you don't have a regular health provider, right, and you're trying to get in somewhere to have a health issue addressed, did you actually have to pay a fee? And surprisingly to me, 21% of people said, yeah, I actually had to pay. And what I had to pay for was 80% said I had to pay for the appointment itself. Sometimes you had to pay for medications or supplies that were part of the treatment. But in, what we're calling, what we have a universal healthcare system, yet we've got a fairly large number of people who are having to pay to access really basic primary care. Okay, so the next part of our survey, moving on, we talked to patients about trying to actually find a family doctor. 29% of people, and this is people, again, across Canada, were actually trying to find a new family doctor or nurse practitioner. Most of them had been looking for less than 2 years. When we asked them why they were trying to find a new doctor, And this was surprising to me. 44% said, well, I'm not happy with the care I'm getting right now with my current care provider. But many people said, well, I recently moved, or my regular health provider's office is just too far away. I can't get there. About 1 in 5 people who didn't have a family doctor weren't actually actively looking for one. And when we asked why, because we wondered about that, many people, so almost more than a third, said, "Well, I'm healthy and I don't need one." Others said, "I'm happy to get care from walk-in clinics." But others said there are simply no doctors or nurse practitioners actually taking patients, or I've been trying for a while and I've just given up. There's no sense in continuing trying. Okay, so now, in this next section, we try and get at what's really important to patients, and some of their values around some of the major issues around primary care. And not surprisingly, we asked about how important they felt it was for people to have some kind of a regular provider. And 97% of people across Canada felt it is fairly or very important that every single person in the country has a regular health provider, a family doctor, a nurse practitioner, or a team of professionals that they can see regularly and access if they need to. 97%. And when we ask them, what are the things that you really value about that long-term relationship with that sort of same family doctor or nurse practitioner? But the answers that came out the top were, they know me as a person, and they consider all the factors that affect and can impact my health. And they also said, they actually make it easy for me to get care during the day. I can get in to see them. For a lot of people, having a regular health provider meant they were able to provide that regular health provider could provide most of their care, usually, or their team could in one place. And to me, what was particularly interesting was, 87% said having a regular family doctor or nurse practitioner, what's most important about that is they stand up for me, and they advocate for me when it's needed. A couple of other sort of interesting and I think important findings. 88% of people felt it was really important for their health provider to be close to their home, to work close to their home. And so that proximity was really important to them. And then, echoing some of what I heard about access to health records. So 75% felt, it's really important to have online access to my health records. And 93% felt it would be important as a province, at least, to have a personal health record where all health professionals who care for me can actually view my health information and contribute to it. So there's continuity and easy access of my health information for everybody who cares for me over time. We asked some questions about walk-in clinics, and I'll give you some of the high-level details. So 47% of our respondents had tried at least once to get into a walk-in clinic in the last 12 months. Typically, that was an in-person walk-in clinic, but sometimes it was a virtual walk-in clinic. And we asked, when we asked, why did you have to go to, or why did you seek care at a walk-in clinic? The number one reason was the walk-in clinic was the only place I thought I could actually get care at that time. And in many cases, it was because people were unable to get an appointment with their regular health provider or someone on that team, or they couldn't get one as quickly as they wanted to or needed to. A bit related to walk-in care. So, we've mentioned virtual care quite a few times, and virtual care is something that has become much more common, through the pandemic, and now even post-pandemic. And so when we asked patients who actually had a family doctor, how many had communicated with their family doctor or nurse practitioner virtually, 71%, said, I have by telephone, 18% by secure messaging, and 5% by video. But when we ask them, what ways of accessing your doctor or nurse practitioner are most important, it was still in-person scheduled appointments. So 92% said these are in-person scheduled appointments are the most important way. But at the same time, people felt telephone appointments were still really, really, really important. I think what's also important out of this is many people, more than half, said, I think that drop-in or walk-in appointments are really important. And I think that gets at being able to actually see someone for an urgent issue when that issue comes up. You can't always anticipate what your primary care health needs are going to be. And then the next question we asked was about online virtual care services. And so we're talking about these virtual care services that aren't necessarily with your regular health providers. And they're services where you can easily connect with a doctor who you likely don't know, that doctor or nurse practitioner may not actually have access to your health records, and you may not be able to schedule a follow-up appointment with them in person. So there are many of these services that have come up. And when we asked about these types of services and some of the constraints they might pose, is 57% of people were not actually willing to use these new virtual services if the service was owned by a for-profit company. 84% weren't willing to use these services if that company then went on to sell their health data to pharmaceutical or insurance companies after after de-identifying their data. So often these companies will sell aggregate data for the purposes of marketing research. So, it is interesting, right? Because while many people are using these services, 27% of people didn't have a family doctor, sought virtual walk-in clinics, some of which charge for services or sell their health data. This posed a problem and didn't necessarily align with their values and the values they feel should be incorporated into a healthcare system and how it functions. We went on to ask about team-based care, and so team-based care, it sounds like you've talked about this already a little bit, but team-based care is simply a way of delivering healthcare in which family doctors and nurse practitioners will work with other health providers like nurses, social workers, pharmacists, and dietitians. And ideally, team members use the same health record and work under one roof to provide coordinated care for patients. And so we asked about team-based care. And 90% of our respondents said they were comfortable getting care from another team member if it was recommended to them by their regular health provider that, I think you should see maybe this nurse or this pharmacist. When we asked who do you think would be most important to have as part of a healthcare team, nurse practitioners, nurses, pharmacists, psychologists these were the top picks and the top suggestions for who might be really valuable in providing in helping provide the whole primary care basket of services that citizens need. And then finally, we tried to get a sense of, how might you reimagine care? Because there are certainly going to be there are different ways of doing things, and I think you'll hear about health systems in other countries and how other countries organize how care is delivered, and so that's coming. One way in which health systems are organized is similar to school districts, where you come into, if you've got kids, that you move to an area, and typically you have a catchment school district where your child will then be assigned to, hopefully if there's room, to that school and to its teachers. And so we asked questions around whether that could make sense for healthcare, where there would be a clinic or a series of clinics that would serve a certain region, and whether it might make sense that when you move to an area, you would be encouraged to sign up with, and there would be capacity for you within your sort of health region and the teams in your health region. The majority of people agreed that this might make sense, and that everyone should be guaranteed a family doctor, a nurse practitioner, a health team in their neighborhood, even if it means that people might be encouraged to change providers if they were to move from one place to another. We also know, so there are trade-offs in the journey to try and get every single person to have a regular health provider. And so, our next questions were around this. And so we asked people, would you be willing to see a nurse practitioner consistently for most of your care, except for when the nurse practitioner thought the doctor was needed? And 91% of people said, I think that would be okay. 3/4 were willing to see any doctor or nurse practitioner in a group practice with shared records, even if it meant they couldn't always see the same person consistently every single time. And 65% of people were willing to have their choices of who could be their regular health provider restricted to a group of providers who serve their region, rather than being able to choose anybody in the province. I want to cover some BC-based data. So compared to, in BC, compared to the average across Canada. So we already mentioned how fewer people in BC had a family doctor or nurse practitioner. Fewer people in BC were able to see their family doctor or nurse practitioner or somebody in that practice within the same or next day for urgent health issues. So, and that's compared to, again, the average across Canada. So we're not quite keeping up here in BC. And fewer people report that their family doctor or nurse practitioner actually works with somebody else in the practice. For example, a nurse or another team member. In BC, we have more people than the average saying care is not available to them outside sort of 9 to 5, Monday to Friday. So it's harder to get in to see somebody on a weekend or in the evenings. We had more people say, I've been without a regular health provider for more than 10 years. We had more people try to get care at a virtual walk-in clinic last time they had a health concern. But the upside is that more people in BC than across Canada reported using an app or website to actually view their medical information. And, I think that'll be interesting to dig into. Is that simply a virtue of my e-health, or are there other ways, for example, that citizens, ordinary citizens are accessing their health information? Okay. So I know that was a lot. And I think we'll try and dig into some of your questions, or if there are, points that need clarifying in the Q&A. And I really hope this at least gives you a little bit of grounding in, what the experiences and values and suggestions for future directions of care are, both, across the country and here in BC. Okay, so thank you very much.